Hi, I'm Dr. Rachel Pope, board-certified OBGYN and co-founder of Menopause. Welcome to Office Hours. This is a podcast where we talk about menopause, perimenopause, and other things that you should be talking to your doctor or healthcare professional about, but probably aren't. Come on in. No appointment needed. So I have Dr. Jim Liu here, menopause expert, legitimately, not just by social media claims, endocrinologist, and I should say reproductive endocrinologist because your training is initially in OBGYN. But I wanted to ask you, why do women bleed irregularly during perimenopause?
So most women develop a regular menstrual cycle probably after 16, after their start of menses. And it's usually between 24 to 36 days. And that's considered usual regular menstrual cycles, fertile window, and that is natural in the way that the system is set up. As the woman hits the 42 to 45 year age range, many of the eggs that are remaining in the ovary are less responsive, and so they can't be stimulated to release on a regular basis as it was during her 25, 30 year age range. And so what happens then is the ovulation is either prolonged, in which case the cycles become long, or because the egg, for some reason, starts to develop and then it fails and it doesn't respond anymore.
Right.
The sudden drop in estrogen causes the bleeding to occur. So it's kind of like taking a birth control pill and then missing 5 days and then taking the birth control pill again. The birth control pill being your artificial ovary. And so if you think about it like that, that would explain why the cycles become irregular. I think that's a good analogy.
That's a great analogy. And then a lot of women talk about having this grand finale, really heavy bleed. Why does that happen?
So that happens because the estrogen is being produced by the ovary, but it doesn't ovulate. And so the progesterone part of the cycle is not normal. And so another egg takes over, and so more estrogen is produced. So the lining has been built up from not one cycle of estrogen exposure, but two or more cycles of estrogen exposure. And then the lining is thicker. So when she does finally have a menses, it's much heavier. There also may be other anatomic changes that are more common in older women, like uterine fibroids, that could cause the heavier bleeding, or adenomyosis, which can be heavier bleeding and severe cramping.
So if you're having heavy periods through perimenopause, go see an OBGYN or a women's health advanced practice provider.
Correct.
Awesome.